Well, I want to welcome Les Jones, Department Head of Department of Health and Middlesex County Board of Chosen County Government. Thank you back, Les Jones, for coming back. And you probably are one of the busiest department heads in Middlesex County right now.
Yes, I am, Mayor. Thank you for having us on today. It's extremely important that we get as much information out to the public as we can during these times.
No, today in the New York Times, there was an article how the national government's expecting hospitals across this country to be slammed with COVID cases starting sometime in December, that they're expecting a record number. What is I know Middlesex County, we've all the municipalities have had a test run over the last 7 months, but what is the local county expecting over the next several months during the winter months?
Well, we have seen starting, within the last month or so, an increase in the numbers. We started back, obviously, March, April, and May, seeing some of the highest numbers, not only in the county, but across the state for COVID. And during the summer months, we saw a dramatic decrease. Our residents were listening to the messaging that we were getting out there about social distancing and wearing a mask and proper hygiene and sanitation. So, but now that we've gotten to the cooler months, we see people moving indoors, we're starting to see an increase in the numbers. We've seen in many of the counties, cases in the hundreds again, which we have not seen since back in May and June. So with that being said, we need to ensure that everyone continues to take precautions, that you wear a mask, you social distance 6 feet away from other people for a time period of at least 15 minutes over a 24-hour period, which is new guidance from the CDC. You need to ensure proper, personal hygiene and hand sanitizing. Soap and water is the best to use, but if you don't have soap and water, then hand sanitizer is the next best thing to use in a pinch. And this is how we're going to get through it. We've heard at the national level. We've heard from our scientists. We've heard from our elected leaders in the state here and in the federal government. Most recently, that we need to take these precautions if we're going to get through this until we have a safe, effective, and enough of COVID-19 vaccine for the population of the country and the world in that case.
Now, I guess last week, Dr. Fauci said over national news, he was strongly suggesting for the Thanksgiving holiday that not a lot of people get together. I mean, what is your take on that? I know Dr. Fauci, obviously, everything that he's been saying so far turns out to be correct. But what do you have to say with county residents down there that normally, historically, on Thanksgiving, you have large crowds in people's private homes?
Well, we would echo that same sentiment from Dr. Fauci, okay? One of the things that we see with the increases of our numbers are people that are getting together. Parties, we've seen a number of parties. We've seen large events where there may be weddings or other kinds of scenarios, and these are potential sources. And of course, with the holidays come up, we've had some holidays, different religious holidays that have gone on. Mm-hmm. We have seen some increases in numbers during those times around the state. And public health continues to respond to those circumstances and to quell the spread of disease. But it's good. It's sound advice, again, taking all the precautions. And until we have a safe, effective, and quantifiable vaccine, okay, that we got to take these precautions. And smaller gatherings. We've all become accustomed, as we're doing right here, utilizing either Zoom or Team or Google Connect or many of the other services that are out there. Many people may be setting up a tablet or a laptop at the Thanksgiving table or Christmas or holidays as they come, through the end of the year here. And that may be the way that we have to connect with our families. But definitely getting together with larger groups of people outside of the family unit we're looking to discourage that at this time.
It's interesting and ironic. Normally during this Thanksgiving and the holiday season in December, your department's normally issuing guidelines on food preparation to make sure nobody's eating uncooked food. But here now they're saying don't even bother getting together with a large family crowd and don't worry about the food.
Absolutely, and even though you're not having large get-togethers or having the entire family, aunts, uncles, cousins, mom, dad, whoever at the Thanksgiving table or holiday table for that matter, everybody has to be vigilant about, safe food preparation. You have to be vigilant about vaccinations, adult and children vaccinations, flu vaccination, because everything that you can do to minimize the exacerbation of multiple things on the body is what you need to do. And so it's important that we still follow all those rules. And again, COVID is just but one thing, but if our bodies are weakened from something else, then that gives an opportunity for COVID to then come in and make people more susceptible.
And I want to highlight what Director Jones just said, is that especially typically when you have family functions during the Thanksgiving holiday, you normally have parents, older parents, grandparents there who may tend to be vulnerable at this point. So I really think that families may need to rethink large, private home gatherings for the Thanksgiving holiday, because what we've seen is a lot of uptick, both at the governmental level when there's a large gathering, whether it be wedding or a large birthday party. Inevitably later, there's some transmissions of some COVID out of that. And I think it behooves us as officials out there trying to stress to the general public that maybe this is maybe you should just have a few less people at your house this year. Unfortunately, or you could still cook this meal and just have it to go.
That's a very good idea because, families, like someone's pie or, someone's pudding or, wherever the case might be. So delivery service is always the best. Take out.
I know my wife has already put in an order from my brother-in-law's. He makes a great blueberry pie. So he could just leave it at the doorstep and he doesn't even have to come over. So.